In the latest Tiffanythinks video, which of course is dateless as usual, we were treated to yet another Baxter removal scene. By the way, I did not think that her voice was weird in any way. Now I'm going to show a series of pictures from this video, and the question I have is, what is wrong with this picture? Well, in my opinion, just about everything is wrong with it, but I am just going to talk about the action itself. Okay, someone's hand is on the skin under which Tiffany's cancerous supraclavicular tumor lies. You know, unfortunately, the inoperable tumor next to the carotid artery and around a lot of nerves. Now, clearly, Tiffany is not enjoying this, and the pressure of the hand is probably causing her discomfort, if not even pain. If you view the video, you will see that the person is relentless and is just continuing to massage that area despite Tiffany's clear discomfort. And actually, the person then uses one finger to contour this entire area, which is the area above which the tumor lies. So for me, clearly, this action begs the question as follows. Should a supraclavicular cancerous tumor be touched, massaged, or handled in any way? The answer is a resounding no. Okay. The medical consensus is that manipulating malignant masses has no benefit, but it does have potential for harm. Let us look at one reference for that. There are several, but let us look at one reference. Here we have a website, Patient Power Navigating Cancer. And the title of this article, written by, or actually reviewed by a doctor, is Oncology Massage Right for You. Now, one may go ahead and read the entire article. I'm not going to do that because for the interest of time. What is oncology massage? Oncology massage is completely different from traditional forms of massage. It uses light touch, etc., etc. It also says that it should only be completed by a licensed personnel. One very, very important aspect of this is the following question. Is oncology massage safe? I'm going to read this word for word for you. Oncology massage is generally safe when performed by a qualified therapist, but there are several safety precautions to consider. You should always obtain clearance from your oncologist before getting a massage, as certain medical conditions and situations are a poor clinical match for massage therapy. Patients on a blood thinner or with low platelet counts should only get a massage with gentle pressure. This is because they are prone to bleeding in tissue, Dr. Deng said. Now, this is the very, very important quote. Massage should not be done directly over areas where cancer is present. The tumor lesions are prone to bleeding and damage from massage. Again, for people watching the Tiffanythinks channel, please do not get influenced by what that person was doing to her. That person should not have been doing that because that person is not medical personnel. Massage should not be done directly over areas where cancer is present. There are no exceptions to this. The only exception is if it's a qualified doctor doing this, okay? And the person in the scene is not a doctor. The experts we spoke with explained that you should not get a massage if you have blood clots, active infection, reduced blood cell count, bone metastases, an implanted medical device, or known skin sensitivities, rashes, or wounds. Well, Number one, Tiffany obviously has a blood clot. Okay, we know this because she told us, and she's on blood thinners. She also has active infection in the sense that there is inflammation there. Okay, there's inflammation under that skin. She has also a lot of hyperpigmentation, but I'm not going to talk about that here. So I'm going to say this once again. Massage should not be done directly over areas where cancer is present. The tumor lesions are prone to bleeding and drainage and damage from massage. Drainage too, I guess. So this is again from the article, Is Oncology Massage Right for You? By Lindsay Modglin, medical reviewer Mariam Lusteberg, MD, MPH. So this is just an article on massage itself, but clinical textbooks and pathology reviews all have the same conclusion. Okay, this is just something that one could quickly access online to basically, how should I say, validate the conclusions that I'm going to make here. So there are other reasons why a cancerous mass should not be manipulated, and I'm going to give a few others very, very quickly. Number one is it could aggravate symptoms. Well, the lymph nodes are often enlarged due to metastases, unfortunately. So rubbing or massaging, it does not improve lymphatic drainage in malignant obstruction, okay? This is very important, and it also can increase local inflammation, it can worsen pain and tenderness, and it can irritate overlying skin that may already be compromised. In Tiffany's case, her skin is compromised. This is obvious even with all the filters she's using, unfortunately. Another reason is what? It is risk to adjacent critical structures. Now, her supraclavicular tumor is near her carotid artery and nerves, all right? So firm pressure can definitely cause discomfort or nerve irritation, and in her case, also lightheadedness, as if she needs more of that. No, she doesn't, if the carotid sinus is stimulated in sensitive patients. So again, it's not a good idea. Risk to adjacent critical structures. And finally, one last reason I want to show is this tissue fragility. This is very important. Okay, what happens is that this cancerous mass that is inoperable is obviously degrading the tissue around it. So the tumor-involved tissue and skin, it can be friable. Now, friable, let me just talk about this word a little bit. Friable, it comes from the French word friable, and it's written in the same way in French, friable, and it means easily crumbled. Okay, it doesn't mean friable, F-R-Y-A-B-L-E, as in able to be fried or able to be put into an air fryer. That would be F-R-Y-A-B-L-E. So this is friable in French, or friable in English. It means easily crumbled. So not to detract from the importance of this little discussion, her skin, unfortunately, is easily crumbled. And also, it's easy to bruise that skin, and it's easy to cause superficial bleeding. And this then would entail a higher risk of skin breakdown or ulceration. And that's exactly what she wants to avoid. So when I saw that scene personally, not only was I cringing when I saw that, but I was thinking, how is she allowing anyone other than medical personnel to do that? And it looks as if the person doing it was her mother, and she thinks it's imparting some sort of benefit when it's really doing the exact opposite. So please do not follow in her footsteps if you have similar mass. So finally, the conclusion I want to draw from this is that only medical personnel are to touch malignant tumors. To everyone else, hands off. And I really hope that this discussion will help Tiffany. I hope that she does see it and goes to the article that I had mentioned, and I will show it once again. Here it is. Is oncology massage right for you? And you can go to www.patientpower.info, navigating cancer, or just type in the name of the article. Bonne nuit and merci. Thank you very much.